Okay, moving on. So here we are. Let's add a session. So we're going to start a review. Now, when you're searching for a client for a review on an iPad, it's not going to be noticeable easily until you get into it, whether you have the right client or not, right? So first thing you want to do is choose what you would like to do. In this instance, we're going to complete a review. And it wants you to put in the first name or the last name or both in order to find your individual. Well, we had 5 people in here with the last name of Test. So let's put in Test and hit continue at the top. And it comes up Cinderella Test. Well, maybe yours is David Test. And you're like, okay, well, that's not the right person. So look at the very bottom of the screen, right in the middle. You see a gray arrow, then a circle, then a blue arrow. That blue arrow to the right, if you choose that, 2 of 5, it gives you Jane Test, the second record of 5 found. You choose it again, 3 of 5 for Jack Test. 4 of 5 is David Test. And 5 of 5 is Stephanie Test. So you always want to make sure that you have your person up there, okay? If you hit the circle that's at the very bottom, middle screen, it shows you that they found 5 records with last name of Test out of 2,848. So that's what it's showing you. So you find your right person before you begin going down this road, okay? So let's go back and we're going to complete a session, and let's find a session for Mickey Mouse. And we'll hit continue at the top. And it's Mickey Mouse. I'm just out of habit, out of very good habit, I'm going to hit that circle at the bottom. You found 1 record. So you know that there's only 1 Mickey Mouse in here, and he's yours and you're good to go. So it gives you information about the individual. And let's back up here a little bit. In Laura's, you would start a review. And as you're going through the review, you realized, oh gosh, they've got some new information that I need to put in the individual profile. So after you process your review, you have to go back in and create a session to create an individual profile, change that information, and then process that, or vice versa. So it was tedious in Laura's. It seems like you had to put information in so many different places in order to get it to take. Here, you put everything in one place at one time. So any field that you change or update when you're doing a review will change and update across the entire system. So that headache is gone. And be very diligent, especially this first time around. Check all of your information on your client as you're going through here. Remember, we're pulling information from one database over to another. We cannot guarantee 100% that the information is going to come over accurately. I feel 99% sure that majority of it is going to come over accurately, but you never know until it transfers and we're updating things. The second thing that you need to pay close attention to is on your 6-month reviews. It's a 6-month reassessment. It's a 30-day review and a 6-month reassessment. Well, what does a reassessment means? That means you're reassessing all the information about the individual. So you need to go through here and update everything. And I'll give you some quick examples. So here we have the primary caregiver, whether they live with the client or not. Are they paid? Are they unpaid? You update anything here that you need to update. The relationship of the primary caregiver to the client. How often does the PCG see the individual? Information about the employer of record. To move to the next screen, you're simply going to take your finger, place it to the right side of the screen and swipe left. And now you'll see information about the attendant or the aide. Are they related? Do they live with them? We've got Elsie, Cal, Martha May right underneath it. We have not related, not related. So that seems like a little bit of redundant information, right? Not related, not related. And right over to the right of that, you see related, yes, no. Well, isn't it asking the same question? It is, but you also have to understand with many databases, things populate differently in different areas. And sometimes it needs to be put in twice just for it to work well in all areas of the database. So when you see a field that seems like it's redundant, answer the question anyway. There's not a field in this database that is not there on purpose. So don't just skip over something because A, you don't know the answer, ask the question, or two, you feel like it's not necessary. Everything is relevant. So it has the age schedule, who the primary doctor is. So this is a great example. Let's say you've been seeing the same client for 3 years, right? You think you know them backwards and forwards, but it would not dawn on the parent or the caregiver to let you know that they changed primary care doctors, right? Well, it's extremely important for us because we're mandated by DMAS to let the primary care doctor know that we are providing services to this client. So ask the question, is your primary care doctor still? And if you change that primary care doctor, admin does not know in the system that that field has been changed. You will need to just make a quick note, contact Tammy, let her know that the primary care doctor has changed, or Ashley, if it's a DD waiver, let them know the primary care doctor has changed for this particular client so they know that they need to send out another release. You'll find the backup person here, phone number, and relationship. And again, just swipe to the left. And this is where you'll document the type of insurance they have. This individual has Medicaid. If they change to Aetna or Anthem, people don't know that we need to know that. They don't understand a lot of times how the whole authorization things work. So they may have gotten notification that their insurance is now changing to Aetna from Anthem, but they put the card in their wallet and they've moved on. Well, their authorization is going to lapse if they don't let us know. So the best way for them to let us know is for us to ask the question, right? Ask, has your insurance changed lately? Better still, follow up in the DMAS portal to check if their Medicaid is active, number one, and if we are, do we have the correct MCO? This is also where you can update and or add phone numbers and email addresses. In Loris, folks made a habit of putting in a phone number, then dash and Jane's phone number. You want to put Jane's phone number over in notes. The phone number field needs to be a field all by itself. Databases, all databases, when you mix numbers and text together, makes searching impossible. It just can't happen. So to keep this database clean, you want to, let's say we're adding a new phone number, you want to add in the type of number that we're adding. Let's say we're adding mobile other. We'll type in the number. And over in notes, you can put who the mobile number is. Same for email address. The type you have self, PCG, EOR, or other contact, or you can just simply put other, and you can type in whose email address that is. And then type in, whoops, didn't mean to do that. Other. Go again. And then type in the email address. Right? So we can make that a little more straightforward. So again, we're going to swipe to the left. You're going to input all of the information that you need to here. What happens during the day? Do they go to school? Do they go to a group day support program or none? If it's none, then you have nothing else to fill out. If they do go to school or a group day support program, we need to know the name of the school or their day program, the time they leave and return, or the group day support, adult daily healthcare or adult daycare. That's what you'll put there. Any impairments, patient pay. This is where you'll see if they have a patient pay. If we've indicated that they have a patient pay of $30, they're going to ask you all about patient pay. And this is something you can contact your trainer on. We're not going to go into that on this particular video. Residence, marital status, race, language. Language is very important to us. Residence, marital status, and race was important to us when we were responsible for doing the level of care reviews reported to DMAS annually. We don't have to do those anymore. So I would like to say that's not important to us anymore. However, after doing this for, almost 14 years, DMAS changes at the drop of the hat, and I'm sure that information is going to have to come back to us in some form or fashion that we're going to need it. So if it's not filled in, just go ahead and complete it. Below that, you will see the consumer-directed status, whether or not they were new to consumer-directed services when they began with us, whether they were a case transfer. And remember, they can be new to CD services and be a transfer. They would be transferring from agency care and not another consumer-directed care provider. One finger will swipe to the left. This is where you'll indicate what services that are being used for them right now. CD is CD, consumer-directed personal attendant, consumer-directed personal attendant respite, or an agency provider for each. Do they utilize private duty nursing? Or an adult day healthcare provider. And again, swipe to the left. Okay, so these are their dependencies. One glitch I did see when we're importing information from Loris over into Ruby, it came over correctly. However, it didn't want to populate in areas that we needed it to populate. So for example, let me just take this out of this. If you see a client, and it's going to be every client that you see the very first time around, I can guarantee that. So no, you have to do this. Does the individual require help with bathing? It says yes, they need help, but the extent of help is not documented. So you'll see a little information icon that I put there, and that will pull over information from Loris. Something would be populated there. Let's say mechanical help, human help is populated. So we'll check that. I don't think I have them. Yeah, this one we have something. Human help, physical assistance. So human help, physical assistance would be populated. I couldn't figure out why it wouldn't come over and then populate this layout. It came over, but we populated the form, so you'll just have to check mark what level of dependency that they need. And again, we'll swipe to the left, and you'll make sure that all of these are asked and updated. Do they need supervision of medications? Are there any range of motion, ROM exercises that they do on a weekly basis, daily basis? Do they need help with ambulation, turning and changing position? Do they need assistance with grooming or general supervision? All other ADLs, you would check off what ADLs they need assistance with, to the level, degree of assistance required for mobility, and their continency score. Now, all of these things are extremely important because that's how the plan of care is populated. So don't not check something or pass by it. It needs to be completed. Swipe to the left. Their behaviors. Behaviors is the only instance on a dependency, gosh, I couldn't think of the word, that you could have two answers. Like this person, Mickey Mouse, could be wandering and passive and also be abusive aggressive, right? So, but you would have the description and where you're getting that information from. Getting the information from is a drop down to make it a little easier for you. And the same thing for orientation. Are they oriented? If they're not oriented, what are they oriented? Person, place, time, whatever, and where you got the information. Meds administered is also a drop down. Joint motion is also a drop down. Then we're going to swipe left again, their level of care score. A lot of people get confused about the level of care score, but it's pretty straightforward. I mean, they either can do it themselves with some mechanical help, or they need help, which is number one. Or number two, they won't take a bath or can't take a bath unless somebody bathes them. They can't get dressed unless somebody is dressing them. They won't eat. They're either spoon-fed or tube-fed. They're totally dependent for mobility. Transferring, the same. They're transferred or does not transfer. Incontinency is a little different here. They're either continent, right? And this is not showing the whole screen. What it should say is incontinent. That's not popping up right. I'll have to fix that for you. But basically, it should say continent, incontinent, or self-care, internal, external devices, or incontinent, greater than weekly, or not self-care. And the word or is the big one here. So they could be continent, but not self-care. Not self-care, they can't wipe themselves. You have a female who needs assistance with her menstrual cycle, so that's not self-care. So we can swipe to the left. We've got PERS, all the information, all the questions that you're used to answering on PERS, therapies, durable medical equipment, current medical nursing needs, medications. Medications we have on 2 lines. The DMAS 99 has 2 lines for medications, so you've got a character limit. If you run out of space on one line, just move to the next line. Hospitalizations, critical incidents, you'll find their diagnosis here. Excuse me. Get some more water. And again, we'll swipe left. Justification. And this is where we will justify hours above their level of care, justify under the same roof or a family member as an aide. Any kind of justification that we need to write for this individual will show up here. So after we've updated everything and gone through everything, we can hit next. And this is where a plan of care, a review will be completed. So we need to do a new review for Mickey Mouse. So we are going to touch here to complete a new compliance review. So we'll touch here. And you'll find your name. And we're going to do a routine review. And again, this is another one of those things that seem kind of silly because it's just repeating the same information. Well, what you see in blue is what is populated on top of the DMAS 99 itself. If you've ever looked at a review, at the very top, it says initial review, routine review, or 6-month assessment. That's how that is populated from that field. What you see in red, initial routine, 6-month transfer, not new transfer, new, is how you are paid. So it's extremely important that the red be completed correctly. Then you go down and answer all the questions as you normally would in a review. Any notes? Do they receive management training? Yes or no? Is there an annual meeting? Yes or no? If they did receive management training, you're going to document their management training here. And you've got lots of things to choose from here, or you can type your own. But this pretty much will cover a lot of things. Is the recipient satisfied with the services they're receiving from the provider agency? It's just like before on your LARAS, you're answering all of the questions. After you answer your questions, you get down to the bottom and you're going to sign it. So you'll hit Service Facilitator and hit Signature, and you will sign. And hit Accept. You'll come over to the consumer, hit Signature for them, hand them your iPad, they'll sign. And hit Accept. And Ruby automatically saves itself, but in the past, we found some incidences where if it wasn't shut down correctly or something wasn't done exactly the way it needed to be done, then sometimes we had a glitch and something didn't save, which is why we've got a fallback. Save, save, save. Just hit that button and it automatically performs a hard save. So if you would like to see that 99, you can view DMAS 99 and you can see the 99 itself. There's the initial visit, the routine, the 6 month, much like you could do in Laura's under preview. So that's how you complete a 99. So you're finished with that 99, but let's look over here to the right-hand side before you do it. So you're doing this and you're sitting there thinking, okay, is this a 6 month visit? Is it a routine visit? We don't know what this is. This is the one we think we just did. If you push on any one of these, it'll take you right to that review, right? And you could tell we've been playing around with Mickey Mouse a lot. So you just touch it and that's the one you're going to go to. So I don't know if I have any more management trainings left, right? So I know over in the red, far right, they've got an authorization for 2/1/24 to 1/31/24. So they had a new authorization start in 2/1. So I know I get maybe I get 2 management trainings with a new authorization, right? I don't know. Let me look at the little information button and it'll bring up your chart for you. So I don't know what we had mouse, but let's say he was Anthem. He gets management training 2 units per year. So not many. So 2/22/24, they've already used 1. 2/25/22, they've used 1. So this dark circle indicates that on that review, management training was used. This is also a great way for you to tell whether you have a visit left or not. So 2/1/24 to 1/31/25, that's a month, but let's pretend like it was 6 months. Then you could come over and count, okay, I had 1, 2, 3 routine reviews. I don't have any more visits for them left. So it's a good way for you to figure out yourself whether you have a visit left instead of doing the review, waiting, oh, no authorizations left, having to go to Slack, say, I don't have an authorization, somebody having to stop, put an authorization in for you before you can move on. So this will let you determine whether you can actually submit a review or not. Submit a review. It'll let you determine before you even go out to the house yourself whether you have a review left or not. So this in the red is a portal to the current authorizations. And right beside that in the black will show you each review that has been done. And we'll pull over all of the dates from all of the reviews that were completed in Laura's. So you'll be able to see those dates and to see whether management training was done on them and what type of review they were. And this information button is always going to be here for your quick reference. So that is how you